Good morning. My name's Alejandro Badia. Can everyone see my screen well?
Yes.
Okay, wonderful. So, as you can see, I'm going to be presenting something that's been of great concern to me for many years, but has been exacerbated after the pandemic and realizing with our many healthcare systems. Obviously, I'm from the United States, but this is become an international problem with the cost of healthcare, largely due to technology and all the things that you're seeing presented today and yesterday. These things cost money, but unless we change how we deliver, care, how we actually deliver that care, the costs are going to be unsustainable. So I'm going to be touching on these issues, and I think many of you, particularly as clinicians, will agree that they're not sustainable. Many times we are paying a price, even though we have the education and the many years of training. There are many sort of peripheral people who are actually sucking money out of the system, unfortunately. And this is causing, at least in my country, early retirement and a host of other issues for access in what is, still the world's #1 economy. And yet our U.S. healthcare markers are not where they should be. And that's a well-known fact. So we as clinicians need to understand the problem. We need to talk about it. Okay. And so this is going to be obviously a much broader topic than, SMA syndrome and many other things that are critical, for that patient. But I would say our healthcare system is actually quite sick. As a matter of background, I did my undergrad work at Cornell. I spent a decade at NYU and Bellevue Hospital at Pittsburgh. I did a fellowship in Germany, and I've been in Miami now for next year will be my 30th year. And then about almost 15 years ago, I founded an orthopedic walk-in center. Some of you may be familiar with our Mark Institute, which is a cadaver lab. At one point, it was the largest in the world for doing surgical training. So all of that is in specifically Doral near Miami International Airport. But over the time, I became an entrepreneur only because I felt like something needed to be fixed. And I will tell you, it's certainly not my greatest skill, but I felt I needed to do something. And I'm going to share some of the things I've learned. For those who don't know me, I was actually born in Cuba, have been in Miami 30 years, but my background, I was very excited when I saw this conference. It takes place in Madrid, and I would like to have gone in person, but my father's family lives in Valencia. So let's talk about Spain. Again, all the healthcare systems, particularly when there is some type of private insurance involved, often have these issues. We know that public health systems many times are strained. We're seeing that particularly in the NHS in England, and certainly in my neighbor to the north of Canada, where many of my patients actually fly down from Canada because they cannot access care in a timely fashion. So in Spain, for specialty care in particular, there is private medical insurance because if not, the care can be very, very delayed, even though I believe the healthcare in Spain is actually excellent. So a quarter of the population now has private coverage. But when I speak to colleagues there, they have many of the same issues that we do, where people who don't know healthcare, don't know medicine, often try to intervene. And that ends up being paradoxically much more expensive. So we should have oversight, not authorization, or not pre-approval, because the pre-approval slows down the process. You have to trust in the clinicians that are in that system. So it's quite underfunded when you speak to physicians there. So I'd love to hear comments about that, perhaps later. But you can see the U.S. is way down in terms of healthcare disparities and markers. And the pandemic exposed many of these issues. So there's even physician strikes now. I have a friend in private practice in Sevilla, and he's kept me up to date with all of this. But they actually went on strike, and I'm concerned that it's going to get so bad in the U.S. that we will do the same. And of course, we've seen that in the UK. So I wrote about a lot of this. Later, it'll be a quick QR code for anybody interested. There is now an audiobook. It just came out, so I did not even put it in my talk. Um, the the book talks about the fact that we in the trenches need to be talking about these issues. So, in terms of orthopedics, which is I'm going to use that as an example because that's what I do. But there are these issues, of course, in all of the major sectors in healthcare, but certainly in the U.S. And I believe this is going to be growing. Orthopedics accounts for about 1 out of 10 U.S. healthcare dollars. Why? Because we're aging. There's much more that we can do wonderfully. I have many friends who've had joints replaced now at this age, and they're incredible. So these are things we couldn't do before. So of course that increases the cost component of this particular specialty. And as we age, we're going to see probably more of that. So at least in the U.S., we are in this sort of perfect storm or imperfect storm, I would say, of healthcare. It's quite expensive, as I said, inefficient. It's even become unpleasant. It should be a friendly when patients are in pain and stressed. It should be a pleasant process, and it isn't. And then the pandemic exacerbated that. And this is a little levity just to outline what the problem is, because the big players involved who are making a lot of the money don't really want to see a change. So they want to just keep putting a dressing on it or give a pill. But the system is really quite sick. Here is this is kind of an old figure, but this is just the cost of injury. Now, it's not just the actual medical cost, but there is, unfortunately, in my country, there is a huge, and I went to this networking event last night here in Miami, and it was quite shocking to me to see almost everybody in the room does not do anything to contribute to injury. And that was what we call personal injury, meaning the patient typically gets into an auto accident, and then there's this cascade of steps, usually managed by an attorney, which really drives up the cost of care. So that is just one component of this cost of injury if it occurred in where there is a legal issue. So use in the U.S. it's about $4 trillion a year. I mean, that's more than by far than most economies in the world, of course. And it's continuing to increase. So look at the curve here between the healthcare spending and yet what people in healthcare during that time. This has been the increase. Physicians at least have been cut for the past 20 consecutive years by Medicare. And Medicare basically sets the bar for the commercial insurers. So that's why we're seeing this issue now where physicians can't actually make ends meet in private practice like I am. 30% of my practice is international, so people fly in. But otherwise, I would not be able to pay my bills as a solo surgeon, a practitioner. Happy to say I do have my first partner in 15 years who joined me 3 days ago. But here's a problem: twice as expensive as as many of the systems. And again, it's not pleasant. This is a little more levity, but basically, it's not efficient, and people wait a long time. And I know we can do better. And so, why is innovation so difficult? Well, there's an excellent article I recommend that you look at this. This is now almost 20 years ago from the Harvard Business Review. And it talks about why is innovation so difficult in the healthcare system. There are really 6 major reasons, but again, the middleman is really the biggest component. Obviously, it's a very regulated system, like in any healthcare system. Technology, I mentioned that. I mean, there's so much we can do now. Next week, that the cadaver lab I told you I'm one of the founders of, we're doing a webinar on a new CT scanner, extremely small, that gives you an image within 30 seconds. I mean, really unbelievable. And we have it inside our lab, almost as experimental. But this is just one example of why costs are increasing as well. And then patients, and many times, are not the direct consumer in a sense, because we have to go through this third party, usually an insurance company or often the government, in order to provide the care, which is really almost the only industry this way. Anything else, any other service provided, the customer, the consumer is a direct relationship. In our case, it's a patient, right? And we need accountability. We need to be safe. So telemedicine, I mentioned the pandemic. I mean, I would imagine there's unfortunately no forum here, so I can see a show of hands, but I really wonder how many people used telemedicine before the pandemic. I can tell you, I because of my practice being in Miami, being very international, people fly in from Latin America, mostly Caribbean, Europe. So in order to create that relationship, I started using Zoom Health. In fact, specifically, what we're using now. I started using it about 8 or 9 years ago. So I've been doing it a long time, but I think telemed utilization went up from 6% in clinicians to 85%. And here's an example. This is not even at my desk in the office. This is my international coordinator's desk. We all have computer blinks once in a while. So I literally went from my office to her desk, and I was able to complete that. And that was early on in the pandemic. But if you look at this article, this is an interview I did in Mexico City. Look at the date here, 2017. So I've been doing this for quite some time. And I think the fact that all of us are on this conference listening to disparate people from around the world is really a testament. And we need to do more of this in healthcare when it's possible. It really does save money and time. And time is money for our patients and for us. So despite what you're seeing, and now, I don't want to make any jokes about our own political quagmire that we're going in. I know the world is kind of chuckling at us, but despite all of this, if you notice, there's very little discussion on healthcare. And I can think of a few things that are really more important, right? Our health. But in our case, it's $1 out of $5. So when people keep talking about the economy and gas prices and food prices and housing costs, why are we not looking at the fact that 20% of our economy is going to healthcare? So this is why I wrote, literally in 10 weeks, I wrote this book during the lockdown of the pandemic. And I mentioned this, our healthcare system is not where it should be despite our technology, and it's certainly not very efficient. This is getting worse. This is time spent on paperwork or disputing bills for patients. This is patients who say they are spending, a lot of time. So why did I start OrthoNOW? OrthoNOW is an orthopedic walk-in center. Okay, a disclosure: I'm the founder and owner. Although we're in due diligence now to have a company take over. Thank goodness, so they can expand it. But I started OrthoNOW because I realized I was seeing cases like this, and this is really terrible. So I'm going to show you. We can talk about stats, but all of us as clinicians, our best examples are really individual patients, right? So here's a lady originally from Brazil, living in the north part of Miami-Dade County. She goes to one of the big hospitals, walking her dog. Her finger got twisted in the leash, and she goes to the hospital and gave her this absurd big aluminum splint that does nothing. And this was a significant fracture. So you don't have to be a hand or surgeon or even orthopedist to realize that this is what we call a long spiral oblique fracture. This will cause significant functional impairment to the hand if not treated well. And these are actually difficult. I will tell you, as an orthopedist, I'd rather plate a femur, bigger incision, of course, but to get this right, to get the rotation, has to be perfect. Patient walks out with this, referral to a hand surgeon. Well, there's not much control in the system. It ends up being seen by a plastic surgeon who's on call for the hospital, but trying to build up their aesthetic practice, and they really don't have a lot of experience in hand, and they do the best they can, but this is what they do, which is really subpar. This is just 2 pins. It's not rigid fixation. You can see they're outside the skin. Patient comes to me like this. Okay, now there is an economic component, folks. Now, anybody who understands, manual workers, you cannot do efficient manual work, or even your homework, or your hobbies, which pleasure, quality of life, with a finger that is painful, stiff, foreshortened, and has a flexion or bent contracture. So this is how it healed. This is what we call a malunion. It means a bone healed wrong. Now, all of this is happening because our healthcare system allowed this lady to be seen and treated by somebody who really isn't the experienced person. It's like her coming with a cervical injury and me trying to treat it. I don't do that. I don't have the expertise. So I had to do what we call corrective osteotomy, brought it out to length, corrected the deformity, did a tenolysis, freed up scar, did capsulectomy, got her full extension, and now this is her. And then I ended up removing a plate pretty promptly afterwards once the bone healed. But you can see there were incisions on the top and the bottom. So I'm just giving you a clinical example. And this is, you can see the stitches are still sort of flaking off. So she basically has full function now. But why did we go through this cost? It is because in the emergency room, the Society of Military Orthopedic Surgeons, so interesting organization, right? 6 years ago, they did this study and basically showed that almost 40% of orthopedic diagnosis in a general ER were inaccurate. And that has an economic cost. Okay, we see this. I hear this from my colleagues all over the world, and it's understandable because you cannot expect a busy ER physician taking care of somebody with chest pain to understand the subtleties of a hand or wrist injury or other things in orthopedics. This is a study done at Shock Trauma, University of Maryland, big trauma center. Over 90% of pediatric fractures are actually inadequately splinted. The initial treatment already we're starting it wrong. And I thought this seemed exaggerated until I heard the presentation at a meeting, and he went through how he got to that 93%, and it really made sense. So healthcare has become more complex. What I'm trying to say here is even though we made this push about getting the primary care doctors to be that gatekeeper, I honestly, and people throw fruit at me for this, but I think that's wrong. I think there's too much to know in medicine. I believe that our primary care colleagues should be keeping us healthy and should be overseeing our care. And there's a lot to do with that. That's obvious. But when somebody has, say, shoulder pain, okay, which is one of the things I do, why have all these hurdles before they get to somebody like me? And the second I find out it's not the shoulder, but the cervical spine, I don't order tests. I immediately get them to not only a spine specialist, but somebody I know who focuses on the neck or cervical spine. So paradoxically, we are not more expensive. When patients come in with elbow pain, most typically it's tennis elbow. Many of you probably suffered a tennis elbow. Everybody comes in almost with an MRI. I have an MRI in my office. I actually have one in my office. I thought it was a worthwhile investment. I never order an MRI for lateral elbow pain. It just isn't helpful. So this is a problem, is that when you see a particular specialist, it ends up actually being more cost effective because we understand the gestalt. So one of the things I say in my biweekly podcast is you should see the right clinician at the right time. Those two things save money. They save money. And that leads to what I'm going to discuss briefly is having more single specialty centers. In other words, having hospitals, big hospitals for the more acute things. As we saw, the SMA syndrome, right? That, person comes in very sick. It's a complex diagnosis. That's a surgery you're not going to do outpatient, right? He demonstrated you couldn't do it laparoscopically. You got to go open. So you need these hospitals. But for a lot of what we do in healthcare, that is overkill. That center is too expensive for that. So this is a long story, but point is that this is an article that was written in Miami about the things we're doing. So here are some solutions, okay? So even though in my book I talk about the problems, which I've been mentioning, now let's talk about solutions, meaning let's get us involved. We in the trenches need to be involved in fixing healthcare and making it more cost effective. We need to minimize that middleman. And I just did a podcast with Elizabeth Haggart. She is one of the premier wrist surgeons in the world. She's now in Doha, Qatar, but she's from Sweden. And she was telling me about one of the reasons she left Sweden is because private insurance went in there and there were too many middlemen. She said, I'm the expert in the wrist. Why am I having somebody telling me what studies I can or can't order? It's absurd. And that ends up driving up cost because that person has a salary and benefits, right? So this is a far reach. There are many hospitals who are nonprofit in the U.S., but even insurance companies. And I really firmly believe that they should not be answering to Wall Street. I mentioned this all-in-one centers outpatient so that you can get initial assessment, diagnosis, possibly intervention or surgery, and rehabilitation all in one center. And then teaching us to collaborate, which perhaps is the hardest things, folks. For some reason, I don't know if it's, organic chemistry and in college and uni led us to be so competitive, but we have to stop that. We really have to collaborate. Otherwise, we are not going to be able to fix this problem, because all of these middlemen know that we do not play well together in the sandbox. And we have to educate the public. And unfortunately, the public's not listening to this. And once the public gets upset enough about it, then perhaps we'll see change. So what does the public need? Well, they need rapid, efficient access to care. It needs to be cost effective and pleasant. And again, the one-stop shopping, because people are busier in the world. There's more traffic. It's not easy to get to your follow-up care. It should really be in a convenient a place that everything under one roof. So what's kind of happened is, because our healthcare system has so many problems, there's been a little bit of tension between the patients and us, and we're really not the bad guys. All right, we're doing our best to help them. So in terms of the political conversation, this is what I'm trying to do, and I've had several legislators who are physicians actually in U.S. Congress and Senate who've been on my podcast, and they're promising to really do something. Again, I'm speaking about the U.S. here, of course. So this is Senator Bill Cassidy. I was so proud. I went to Washington, D.C. with both my children. My son is way taller than me now. This was only about 3 years ago, and he has read my book. The problem is that, talking to the middleman is like this. It's very, very challenging. So we need to minimize the role of this, and that's going to require us getting together and saying enough. I don't need you, Mr. Bureaucrat, to approve care that I'm recommending as the most qualified person. Okay, so here is, for example, there's a section in the book that says authorization is a 4-letter word, right? A little bit facetious, but here's an example. And speaking to my internist, who's in the same building, again, convenience, same outpatient building. My internist, who I saw recently, had blood work, and he was telling me many of the blood tests, they have to go through all this process, and all of this process it costs money. So why is my internist not the best qualified person to decide what blood work I need? Right now, there are people who overorder tests or maybe do too much surgery, et cetera. That's why we do need oversight. Okay, so oversight is okay, and I understand the insurance industry, our government may provide that. But here's the problem. This is the growth of administrators, 3,000% over the last 50 years compared to physicians, which is, it's single digits, I believe. So at least in the U.S., we're going to be about 120 to 140,000 physicians short. In fact, in my state of Florida, I was just lecturing in Columbia last week in Cali, and they told me that they're relaxing now the way for foreign medical graduates to come to the U.S. because we simply need good doctors. Okay, and here's the growth of salaries. I don't want to put anybody in a bad mood, but my God, it's amazing how the administrators' pay has gone up, and not the same for physicians. So I won't belabor the point, but this is insurance. I every day I ask myself, what does this person actually do on a day-to-day basis? What do they do? I know what I do. I know what my predecessor does in general surgery. We know what they do. All right. Pharma is different. Everybody likes to knock on pharma, but I appreciate the pharma industry because they come up with most of the drug advances. Okay. And the reason it's so expensive, at least in the US, for meds is something called PBMs. Pharmacy benefit managers. They are an incredible middlemen. And I mentioned them as well. Now, here's another problem we probably don't see so much in other countries. I'd be curious to hear feedback. But at least at least in my city, and I'm really embarrassed about this, my adopted city in Miami, it's been estimated that half of the Medicare fraud comes from Miami. And this character was actually pardoned for it by our former president. It's unbelievable. Now, here I had some hope. What do these guys have in common? They are both orthopedic surgeons. Tom Price was a congressman and a founder of Resurgence, a big orthopedic clinic. He was the Secretary of Health and Human Services. Unfortunately, there was an issue where he used a helicopter for his family's use or something, and one of these, Democrat versus Republican scandals. So he was ousted, but he's a very well-meaning guy. He was on my podcast. And the only past president of the AMA, who was an orthopedic surgeon, is Andrew Gurman. And Andrew Gurman happens to be a hand surgeon. So I thought these guys were in power at the same time. I thought, okay, we're going to get some real healthcare fix now. It did not happen. It did not happen. Here's Andy Gurman at my home and in surgery with me. And yet he honestly, he didn't want to contribute to my book. So there's politics everywhere. It's really unfortunate, but here's a very talented person who had power to make change. I mentioned this before, nonprofit, that's going to be very difficult. I'm a capitalist. I was born in Cuba, so I believe that if they do a good job, they should be compensated well. But that's not holding true for physicians, as we have been cut every year. And this year, it's going to be a 2.7% cut by Medicare. But we're still in an inflationary environment, so it's a lot more than a 3% cut. Okay, I mentioned this before, all-in-one facilities. I'm going to give you a little bit more example of this. So how do we achieve it? Well, I'm going to give you, of course, the example of orthopedics, but there's now outpatient sort of heart centers, women's centers where a woman can get a quick physical exam, a pap smear or something without having to wait for an appointment with her OBGYN. These are all conveniences that actually save money and save time and have all the diagnostics on site. Okay. So there are been shifts, and this was all accelerated with what we saw. All of these things, which most of them are very, very good, right? There's outpatient diagnostic centers. In the US, there's general urgent care centers. Now, I want to emphasize again that if that urgent care center sees somebody an orthopedic issue that is not very clear, very important for them to get them to the right specialist right away in order to avoid the debacle you saw with that proximal phalanx fracture. Telemedicine, we discussed. Ambulatory surgery centers. Next month, I'll be in Chicago. It'll be, I think, the third year in a row I speak at this amazing meeting called Becker's Healthcare Conference. They have one for anesthesia. They have a dental one. It's really an amazing conference. So that'll be end of October, and we're going to be discussing the growth of ASCs. But still, hospitals get paid so much more than an ASC for the exact same care. So we're going to need to shift that, because otherwise, the hospitals are going to be doing cases that really don't need to be done in a hospital. And what's going to happen is these people, right, the big companies are going to start stepping into healthcare, at least trying. All right. So here's an example, right? So this is actually approved. A hip replacement is approved in the US now as of about 4 or 5 years ago for outpatient, which is, kind of a big surgery. They have to walk on it. All right. Shoulder replacements were only approved the beginning of this year. This is what I do. I do shoulder prostheses. I've been doing them outpatient 15 years, but I cannot do it on a Medicare patient. I cannot do it on some of the commercial insurances. And this is something else. It's a passion of mine. Very big in Europe is a prosthesis for arthritis in the base of the thumb. To this day, that cannot be done in my outpatient center. So what does that tell you? That the bureaucrats, not the clinicians, me and anesthesia. So this is a surgery and anesthesia conference, right? Why is it that we can do a hip replacement, which I know is a nightmare for some of the anesthesiologists, right? Depending on the patient and their BMI, et cetera. Yet this is a very easy surgery. I need a tourniquet on the arm, an incision that's this big to give somebody pain relief for painful arthritis. And yet I still still to this day cannot do it in my center with many insurances. So that has to change. So there's no gray hair. I've been writing about this for the past almost 15 years. Okay, so this is an emerging healthcare entity in the U.S. There are other specialty urgent cares. So I think we're seeing already, and the data will come out about how we save money. And we already have that. The Journal of Orthopedic Trauma had an excellent peer-reviewed article on how orthopedic urgent cares or orthopedic walk-in centers are saving money and decreasing that 40% inaccurate diagnosis that we see in a general busy hospital emergency room. Okay, so so this is actually our old logo. That's how long I've been doing this. You'll see our newer one, but the point is that very few facilities fall in this quadrant of very high expertise, but very easy access, very high level of access. Okay, so emergency room, I mean, for real emergencies, that's what you need, right? But for routine things, it's not easy. You got to wait many hours, and the expertise isn't always there because the physician needs to know everything about everything, which is really impossible. Okay, so these are just cost differentiators. We looked at this just for a patient with a wrist pain. It ended up being Dequervain's tendonitis. So many of you primary care doctors know also this painful tendonitis usually just needs an injection. It doesn't need an MRI, and this is what they get many times when they walk into a hospital with severe wrist pain. Okay, so we have to use technology. This is something that we're going to be even upgrading further. But there is an app. So if any of you are curious and into digital health, just go to your app store and just type in OrthoNOW and surf it and give us some feedback. Love to hear it. But the point is that we're using digital solutions in so many sectors, and we're really behind in medicine. And there's so much. There's a big digital health conference coming up soon in, I think, next month in San Francisco. But yet most of those innovations are not really reaching the public yet. So it's there. The technology's there. We're just not embracing it. And this is why most of my friends know about this. They don't have the app on their phone. It's very curious to me. So don't call me when they have their kid in the emergency room. I say, why are you calling me? I'm not an answering service. So just I told you to download the app. It's so easy, right? But business is realizing this. This was the front page of a major business newspaper, and this is a front page. So you can imagine that they realize that orthopedics has a cost to their business. Now, you wouldn't want to come to OrthoNOW with this, right? This is a subtrochanteric femur fracture, or this, a femoral shaft. But every other fracture here we see. And of course, 70% of what we see at an OrthoNOW is actually pain. So one of the things we want to do with companies is be able to bring services to a big company. There's an Amazon distributor very near the flagship OrthoNOW, near the Miami International Airport. It's amazing when I see their injured workers. Jeff Bezos is a very smart guy, but I can tell you, in terms of how they're accessing healthcare, it's very expensive, and it can change, but it requires engagement. And we've been in the news for a long time with this. This is, 10 years ago, 11 years ago. So this is not new. This is 5 years ago. This came out, believe it or not. This is a Wall Street, and because I think even Wall Street realizes, hey, there's money to be made in healthcare as we make it more efficient. All right, and I mentioned that the pandemic is accelerating this and many other things, which I call a silver lining. So we need more transparency. That's something I know that the former administration was pushing for, and this started actually with George Bush. So this is a report that I'm able to send to you if you're interested. So again, I mentioned this before. We've got to collaborate. The insurance industry, everybody knows that doctors do not collaborate well. All right, they talk about herding cats. All right, so that we have to change that. And then educating the public, right? Saving the whales. My God, I mean, what a big issue that was many years ago. Wonderful issue, but then we had this. Unfortunately, some bad cops led to incredible social, demand and change. But I don't understand why the public hasn't yet gotten upset about, my God, wait a second, I have a tumor. I just posted this on our social media. A physician saying, my God, I have a tumor. I need to get an MRI. And the insurance says, well, why didn't you have to get a CAT scan first? And the doctor says, well, I don't need a CAT scan for the tumor. It's a waste of money. I need an MRI. And then the patient is the one suffering and may die, right? Or may end up with a stiff finger, as you saw. So the patients are the consumers, really. Now, again, I'm a capitalist, and we all come from different political and healthcare systems, but I really believe that that we should be driving this, and we can lower the cost. Okay, and I would love to see in the future that health insurance is more catastrophic. Again, you get diagnosed with a stage 4 cancer, you get hit by a bus. Okay, those things will be incredibly costly, but at least the money I'm spending in my own employees for health insurance, I'd rather that we just pay for it. I think we may see something like that. So the bureaucracy is also incredible. This is the most interesting man in the world. And when I had my beard, somebody snapped this picture of me. I was in Orlando. So you can imagine there is a different ICD code or diagnostic code for being bitten by an alligator versus a crocodile, which is what we have in Florida. That's pretty silly that bureaucrats sat around in a room and said, we're going to have different codes for these things, right? Instead of just saying an animal bite. That to me shows a waste of time and resources. But we have to always improve, and thank God we are. There is, scientific innovation. We've seen some incredible things at this conference. I mentioned this before, for those of you who don't know, this is a cadaver lab. That's the auditorium, seats 104. Perhaps the organization would be interested in doing something here in the future, because it's very easy to get to near the airport. And there are, actually, there's 36 stations. We took 4 out for research. But these stations, there's teaching cameras. It's really very state of the art. It's actually an old picture. I need to update it. So here's a book for those interested. There is an audio book now for people who want to listen when they drive, and I'd love to hear feedback. The only negative reviews that I've gotten in this book have been from physicians, and it's been like 3. And it's really sad. It tells me that we're not collaborating. One admitted that he hadn't read the book, but he saw another review by another doctor, and he decided to just bash it. It really is amazing. This is a video. I think I have time. This is just a little summary, talks about everything I'm saying. Please let me know if you hear the audio. I'm not sure.
I don't think we can hear the audio.
Yep.
We can't hear you as well now. No, still no.
How about now?
Yes. Yeah.
Okay, sorry. Okay. Sorry about that. So this is a slide from one of the debates, and what's amazing, I mentioned this before, that healthcare was not even discussed, and yet if you remember with Hillary and then Obamacare came in. I mean, that was a big. But I can tell you that Obamacare is not actually lowered. There's been some good things that have come out of it, but it is definitely not lowered the cost of healthcare for all the reasons I mentioned. And the largest one is really the middlemen. So I don't know what's going to happen. It'll be interesting the next debate. I don't know if in other countries, if this is covered in debates, but so for example, many of you probably use some type of regenerative medicine, right? There's incredible science is coming to light. I think the public doesn't understand it. They come in asking for stem cells, and then I have to explain this to them. But I'm very worried because at some point, if insurance covers this, it's going to be an issue. But so this is a little bit of a little joke about Obamacare, but it's this is the problem is that people are peddling, and until physicians take a hold of this and get involved in the legislation and the regulation, we're going to see this where and I think it's a chapter 10 of my book. It's literally entitled "Opportunists in Healthcare." There's so many opportunists, and they're making money, and most of them are actually making more income than we are. They're smarter at making money. We're smart at taking care of patients. So this is a podcast. There's been a host of I'm about to select my next guest for next week. It's actually every other Thursday, 9 a.m. U.S. time. It's right now it's about 8:15 in the morning here. So what can you do? Well, we all kind of understand the issues, but I spend a lot of time reading about these things, outside of science. So it's hard for us because we want to read our medical journals. We need to keep up, but I think we need to start engaging with the problems in our healthcare system. Explain to at least your immediate circle, your friends, and obviously your patients. Explain to them why it's so difficult for them to get an appointment with you, and get engaged with the politicians. And now we have social media. At least, social media has many ills, but certainly there are benefits. This is why it benefits our patients. So we have to care about them. They are the ones who ultimately are being affected by all the problems we're seeing. And I don't want to be a Debbie Downer after all the amazing scientific presentations that we've seen, but I feel like we need to talk about this. For those who are interested, there is an audio book now which you can find, but if you want to just record that QR code, that's and I'd love to hear more feedback actually from fellow clinicians about this. It's really important. That's just for my own website. That's the way. That's in Spanish because many of my patients again come from Latin, but that's how they reach me. But my website, it's pretty easy to access. And then social media. Many of you have social media where you discuss many of the issues I'm talking about. So if we can collaborate, then we can get message to the public. Thank you so much. I don't know if there's time for questions, but I would welcome any.